One of the things I want to impart to you is something I told my son, and that is, it's going to be a very bad year, but I am not going to die. Hi, my name is Barbara. I am 71 years old. I grew up in Yonkers, New York. So, I want to talk to you today about Breast Cancer Awareness Month and my own experience with breast cancer. I have been a breast cancer victor, as I call it, for 14 years. Yes, that's right, 14 years, and I'm doing very, very well. I was first diagnosed in 2006. I was told that I had ductal carcinoma in situ, which is a pretty good kind of cancer to have. I had had many, many operations and biopsies, and this was the first time I actually thought that nothing was the matter. I've never felt a lump in self-examination or examination by a doctor. It was just there. My mother had breast cancer, but I am not a carrier of the BRCA gene. So when I heard that, it was a life-defining event. So I was diagnosed when I was 57, and I am now 71. So I've had some wonderful years. It took me about a year to feel myself again because I suffered from chemo brain, which is a little disordered thinking. I couldn't concentrate very well. I'm an avid reader, and I wasn't able to remember a lot of things that I was reading. So I was very gentle with myself. I relaxed. I walked around. I tried to read shorter things like magazines, and I didn't pressure myself to come back to myself. It's a good idea to just let things be. So when I was diagnosed, of course, I told my friends and family. One of the things I want to impart to you is something I told my son, and that is, it's going to be a very bad year, but I am not going to die. And in fact, you see me and I'm doing very well. I'm in total remission, and I'm very healthy and active and have 100% of a full life. It's important to keep in mind that you will too. Keep a good attitude. It's very important. Do things for yourself and make sure you have a good support system. 1, to keep it going, and 2, to recommend things to you to do for fun, and 3, to take notes when you go to the doctors or tape those sessions so that you can come back to some of the questions you have. So I didn't really have any symptoms after diagnosis. I did try having a mammogram, but because I had implants, nothing really came up. But I want to remind you to have mammograms. That's what the purpose is of Breast Cancer Awareness Month. So I was told to have a lumpectomy, and then I would need radiation. I had a lumpectomy in May of that year, and I woke up to my doctor looking very grim at the bottom of my bed, who said to me, "This didn't work. You need to have a mastectomy." We also found another cancer. That cancer was determined by taking out 17 lymph nodes out of my right arm. And so I was told that you need a mastectomy. In further conversations with him, I decided that I wanted to have a bilateral mastectomy. I brought it up to him because I had many biopsies before. I had dense breasts, and so we were always doing biopsies. And my mother's a breast cancer person who had breast cancer several times before she passed away. She was a survivor too. So my treatment after my breast cancer surgery and my mastectomy was to have adriamycin, Cytoxan, and Taxol. ACT at that time, the most hellish of treatments. Adriamycin is considered the red devil because it's a very strong chemotherapy. I had a very hard time with it. Cytoxan was okay, and Taxol created neuropathy in my feet, which never will go away. and I treat that with medications and good exercise. And so that is very easy for me to do. But many people do get a reaction to the Taxol, and for many people, most, I think, the neuropathy will go away. I had several small strokes that were brought on, we think, from the emobrain. And so some of my reactions were, I would say, the opposite of the word that I was trying to say. So in order to not stress myself more, I just let it pass. And that was very healthy to do, and it all came back. I had been in remission, as I said, for 14 years. And my remission is great. I feel great. I help a lot of people that have breast cancer. I talk to them. This year, 5 of my friends and relatives have had breast cancer. So I would recommend a couple of things, and that is that you get yearly mammograms. In my case, because I had dense breasts, I had mammograms every 6 months. At that time, I also had ultrasounds, which I had been told about getting at the same time. In fact, through my mammograms every 6 months were completely clean. However, it was the ultrasound where discrepancies could be picked up and compared to the mammogram, and that is how my breast cancer was found, by having ultrasound and a mammogram at the same time. I would highly recommend that, especially if you have dense breasts, as I do. And again, LabFinder can help you set up those tests, and then you can have your records. I didn't have my records. LabFinder was not in existence at that time, unfortunately, and I never even read my records till well after I had those surgeries. LabFinder, a newer company, can help you with that. To help you set up a mammogram and to get you the results through your portal 24 hours a day, 7 days a week. In fact, I have had another cancer, a women's gynecological cancer, and I see some doctors in New York as well as in Sarasota, Florida, and I follow LabFinder. I have a portal, and I get my results right away, and I can bring them to my doctor so I can ask more important and more critical questions for my well-being. I would definitely recommend that you get your tests through LabFinder. Breast Cancer Awareness Month is very important to me because I consider myself a breast cancer victor, someone who has gone through it and is still alive, well, and kicking, and enjoying life to the fullest. I can do anything and everything. I travel, I visit people, I'm a grandmother, I play with my grandchildren. My life is very complete. And it's because of early diagnosis that helped me greatly. I was told that if I did nothing, I wouldn't probably feel a lump for several years. So it's very important to get checked. And that's why we have a Breast Cancer Awareness Month. My final thoughts, please don't be afraid to get tested. It's very important you do that, and that's why we have these awareness months to remind you. Again, if you need to get a sonogram, if you have any breast cancer history of other people in your family, it's important to do that. I would also recommend you get BRCA screening. I did that immediately because I have a daughter and other family relatives, and I do not have a BRCA gene. But since that time, I've had other testing because there are many more genes to test about, and I do not have any other genes that would incline me, as of a few years ago, to get breast cancer or any other metastatic cancer. So that's what we're working on. I do use LabFinder, however, because I have had a cancer that has no relation to breast cancer. And so, using LabFinder and using my portal, I can bring those reviews to my doctor, my internist, as my doctors follow me in Florida. It's very important. I come in to the city, I have lab work done, and I can bring those reports to my doctors in Florida.